It's about taking charge and control and educating yourself, finding the resources. That's what my company did for the past 10 years before I sold it, was I provided resources to individuals who did not have those resources available. A lot of times we go to the doctor, what happens? We're there for 10 minutes. They come in, guy pulls his glasses down and says, what are you here for? Writes you a whole bunch of prescriptions, and then you're out the door. You have no idea what's going on. You're leaving, so now you found out you got high blood pressure, you have diabetes, and you got 10 prescriptions, but no one's told you how to properly manage this, right? Is it time? I don't know what the issue is. That's something that I'm still working on today. That's why I'm doing my healthcare management degree, and that's why I went to medical school, because I can't figure out why so many people are left behind. And like I said, I did a study when I was in school. 80% of the patients that I saw in the hospital setting were there because they made poor lifestyle choices. You know, I don't believe anybody wants to be sick. I don't believe people want to be overweight. I don't believe people want to have diseases. What it is, a lack of education. And that's what this whole process of why we're here today, is to educate individuals. Be surprised how powerful education is. I mean, I've been in school for the last 18 years, so I mean, I'm kind of a glutton for punishment, but, all right. But like I said, it's educating. Understanding what diabetes is and what the effects are. Cardiovascular disease and where it can go. What can we do to prevent these disease processes? Another is cancer. Do you know that prostate and colon cancer, African Americans are have a 33% higher mortality rate than Caucasians? Normally we start screening individuals for prostate or for colon cancer at the age of 50. It's recommended that African Americans start at 40. Wow. 33%, that's a high percentage. Now your women aren't off the hook either. What do women get? Breast cancer, right? Women have an 18% higher mortality rate than Caucasians, because there's several genes that cause breast cancer, but in the African American community, they have a more aggressive gene that's taking 18% more African Americans than Caucasians. Now think about it this way. Cancer can be prevented. Cancer doesn't start all over the body. It starts out very small. You have to agree with me that if we found cancer when it's that big, relative to this big, could we have maybe made a change, a cure? It's a lot easier, right? Before we have to start removing prostates, having mastectomies, right? It's all about proper screening, about proper education. Do you know that proper screening and finding cancer early, your 10-year survival rate increases by 80 to 90%. 80 to 90%, that's significant. And all that is getting the proper education and the proper screening to take care of your health. Like I said, this is all, we can believe in what we want to believe in. We can have our sons, we can have our daughters, we can have our businesses, our jobs, but if we don't have our health, we don't have anything, guys. It's as simple as that. We can want to change the world, but if I'm not healthy, what are we going to do? We have no opportunity to change. So what I'm trying to get at more than anything is take care of yourself. I hear all the time in my clinics, in my settings, is, oh, I don't want to go to the doctor because I don't want to find out what the results of my blood work is. I don't want to know if there's something wrong. You follow me? Cardiovascular disease just doesn't happen.